Stefansic. He's the chairman of the 2016 SEMDA conference. SEMDA is a partner of ours, and so he just has a few words to tell you about the conference.
Great, thank you very much. Good to see some familiar faces here, see some people from other parts of the Southeast, Memphis, Atlanta. Just a quick announcement about SEMDA. So SEMDA is the Southeast Medical Device Association, and this is an organization that's primarily been run out of Atlanta, and the conference has always been in Atlanta for the last 10 years. Well, the board got together, the board expanded to other parts of the Southeast, and they decided we want to go somewhere different this year, and they picked Nashville. So we're really excited. I've already talked to some people in the room about the conference, and I think what's important for the audience in this room, I know this is more of a healthcare IT crowd, and actually my company, Pharos, is a healthcare IT company now, so I've been fortunate to work in the device space and the kind of the healthcare IT space. Is there really is less of a divide between those two. So with interoperability and with the Internet of Things and trying to get data out of devices, we're going to have a digital health panel. Actually, I think we may have 2 digital health panels at SEMDA, so I encourage you to look at the agenda. It's on our website, semda.net, and the conference is May 17th through 19th. And for all the entrepreneurs in the room, I know we're going to see some companies pitch here. We do have a pitch rounds competition and kind of networking where it's kind of like a Match.com. It's a pretty sophisticated platform we use to match investors to companies. And we're getting the investors. If you go to the website, you can see the list of investors. There's many from the Southeast that not only do devices, but also do healthcare IT. So I encourage some of you to look at that and look at the opportunity to come. You'll get matched with at least 8 10-minute meetings with investors. We pick winners that then pitch on the main stage to the entire audience. So please take a look at that. I'll be around until 5 o'clock. If you have any questions about the conference or want to learn more, just let me know. And one last thing, for those of you that are in this area or further west, I guess, towards Memphis, we are having an event Thursday night in Memphis, a SEMDA event. If you go to the semda.net website, it's free registration, and you can network with some other medical device and technology executives in Memphis. So thank you very much.
Thank you for that. So next we have the rapid fire session where 3 companies will be presenting what they do. And I just want to mention Health Connect South tries to not focus on health IT, but break down the silos that we have in health. So we want this interdisciplinary collaboration to happen. We want connections to happen that are not just health IT. It can be from biosciences, medical device, it doesn't matter. Pharma, anything. So this is just a showcase of companies that are working on amazing things in health. We have Moving Analytics, Dr. Hirsch Vatsanga. His technology helps hospitals implement home-based cardiac rehab. One second, sorry.
Left, right, So good afternoon, everyone. It's been a long flight for me, but I'm really glad I had the opportunity to attend and speak to you today about what we do. I'm Harsh Vatsangam. I'm the CEO of Moving Analytics, and we help hospitals implement home-based rehab programs for patients who've had recent heart attacks, heart failure, heart surgeries. We launched our product last year around the same time, and we're working with 10 hospitals right now in helping them increase access to rehab in their patient populations. And I'm here to tell you why they signed up with us and why I think many more will sign up. So this is John. John just had a heart attack, and after his heart attack, he was prescribed cardiac rehab to improve his cardiovascular fitness. If John does cardiac rehab, he cuts his risk of readmissions by half and reduces his risk of getting a second heart attack by 60%. This is a program that can literally save many lives. However, despite such compelling evidence, there are 3.5 million patients like John every year, and only 20% of them do rehab today, and only 5% complete their programs. So you're really looking at like 95% of patients who are eligible don't complete cardiac rehab. And why is that? Well, if a patient like John has to participate in rehab, he would have to visit a hospital 36 times and spend $1,800 out of pocket as copays. So most of the time he doesn't go. This is a problem not just for John, but for our hospital too. In a fee-for-service world, hospitals earn revenue by bringing as many patients into rehab as possible. So if patients don't attend rehab, they lose a revenue opportunity. And the changes in the healthcare law and the Affordable Care Act, most hospitals are shifting to value-based purchasing models and bundle payment models for heart disease. And under these models, a typical hospital would lose about $4 million in readmission costs every year because their patients don't do cardiac rehab. In the United States, that's $1 billion that hospitals pay out of their pockets every year because patients don't do cardiac rehab. It's quite a big problem. So hospitals are really looking for ways to increase access to rehab, but are limited by the physical infrastructure that they have. And that's basically where we come in. So we help hospitals implement evidence-based cardiac rehab programs that their patients can do in the comfort of their homes. And we do this with technology, but there's a cool thing about us, which is we're actually based on a ton of research. We're based on a program called MultiFit. This is a program that was developed and validated at Stanford University. It's a home-based cardiac rehab program with 20 years of evidence, multiple randomized clinical trials behind it. And it's been shown to reduce readmissions by as much as 87% in patient populations. This program is so good, it's the standard of care in the Kaiser Permanente health system. All the cardiac rehab is done this way. What we've done is we've taken this program, and we have a worldwide exclusive license to it, and we've digitized it into a case management system for nurses and a mobile app for patients. And I'll quickly take you through what we do with it. So when a patient is discharged, the nurse basically uses our software to create a smart care plan for that patient based on their pre-existing conditions and their symptoms. And this plan is downloaded as an app on the patient's smartphone or tablet. So at home, the app guides the patient through daily rehab goals, things like doing their daily exercise, watching educational videos, tracking their diet, checking that they did their medications, and so on. The patient can also use our app to communicate with their assigned coach, or who's usually a nurse case manager, to ask any questions and get them answered. This information is recorded by the app, given back to the nurse. And once a week, the nurse and patient have a phone call where the nurse goes over the patient's progress and essentially revises their care plan and helps kind of provide motivational interviewing. At this stage, we actually highlight key issues that the patient has had by analyzing the patient data and make it easy for the nurse to have that call in 15 minutes or less. This goes on for 12 weeks, and basically it's done. So care that's delivered in this fashion is great for patients like John because most or all of it's done at home, and it's a third of the cost, and in some cases it's free for patients like him. So it's much more convenient. It's also great for a hospital. We estimate that based on our current clientele that we can basically increase cardiac rehab penetration to 50% of their patient populations. So that would save $2 million in saved readmission costs per site per year. That's kind of helped, that messaging has helped a lot with our traction. So as I said, we're currently in 3 hospitals deployed and used on over 100 patients so far. 500 patients, sorry. This includes like Langone Medical Center, USC Keck School of Medicine. And next week, we're actually kicking off the next set of hospitals. We are going to enroll in 7 hospitals. And that includes UCSF, Mayo Clinic, Florida Hospital, the largest cardiovascular practice in the country, the VA in Atlanta, VA in San Francisco, and many more. And besides this, we've got another 30 clients on the wait list to deploy. This is possible because of an amazing team. In addition to the technical team, which you see on the left, we've basically taken the original team that built the MultiFit program and validated the program and hired them into the company. So Nancy Miller is the former associate director of the Stanford Cardiac Rehab Program. She provides 25 years of clinical expertise in chronic disease management in our company. And in addition, we have Linda Murdoch, who's been responsible for rolling out home-based cardiac rehab programs in over 20 hospitals in the country. And this is one of the great things that our clients appreciate a lot about us, which is we have that expertise in-house and they feel safe working with someone with that level of expertise. Basically a business model is straightforward, $300 per patient per course of treatment. So that means for a typical hospital, for helping them get to 50% of their patients, we can earn $180,000 in revenue per year. And this is a recurring revenue because you have a rolling patient population usually. Our total addressable market is the 3.5 million patients who are eligible for rehab today, and our current price point, that would give us $1 billion price point. And initially, we're focusing on hospitals that have value-based purchasing models and have low to moderate risk patients. That's about a $75 million slice. And our goal is to hit that market. Our goal is to hit 150,000 patients in 5 years. That would give us a $60 million revenue based on a phased rollout process. It's important to remember this is still only 0.5% of patients that are eligible for cardiac rehab, and this doesn't include other comorbid conditions like diabetes, heart failure, and so on, which would give it a much larger market that we would go for. And our main competitive advantage really has been the evidence behind our approach. This is a well-validated program, and that's why our clients have picked us over any other competitive digital health platform, and the domain expertise, because they feel comfortable that they can basically work with us, and we would help basically train their nurse teams and their staff to deliver a quality program. And really, we've combined that into an easy-to-use technology platform that everyone can use. Quick thing, we're almost done with our $1 million seed round, just a tiny bit of about $50,000 left in that round. Our goal with this round is to get to 2,000 patients in the next year, and also to sign 30 additional hospitals. And to do that, there are key hires that we'd like to make, sales, in customer support, and in engineering to kind of scale out our platform. At the end of this, we should be all set to achieve $1 million in annual run rate. There's a lot more I can say. I'd like to end with this thought, which is something I said earlier. A patient who does cardiac rehab doubles their chance of living another 5 years. So think about that, and think of the number of birthdays, the vacations, the anniversaries, the time spent with your loved ones. That's the kind of impact that we're going for. And I think, revenue business models aside, our mission is to really get all those 3.5 million people who are eligible for rehab to get rehab. That's the care they deserve. Because right now they're dismissed with 2 sheets of paper and asked to come back after 6 months. And to me, that's a crime. So we're looking for people to join us in our mission, work with us as collaborators, people who would like to invest in us, and obviously people who would like to work with us as employees as well. That's it. And if you have any questions, I'm happy to answer them. Once again, I'm Harsh, Moving Analytics. Thank you.
So question, you say it's only 5% of this total addressable market which are actually utilizing the service provided by the providers. What is it that the 95% is doing? Is it all cost? Is it time to delivery for them? Because there's a personal ROI, I imagine, for the people when they decide to or not to go.
So to repeat your question back to why don't the 95% complete their rehab? Is that the question? Okay, so so think about it. I'm 55 years old. I have a day job. It's maybe an hourly wage. Thank you. It's a suntan lotion, so it's a. For that person, they just had a heart attack because maybe they didn't eat right and they didn't exercise enough. Their surgery just cost them $5,000, even with copay, right? So, and then they are asked to do cardiac rehab, and you tell them, okay, it's great, but you have to attend our hospital, come to our outpatient clinic, which is an hour's drive away from you, 36 times in 3 months. Not only that, you're going to have to pay us $2,000 out of your pocket to continue this program, and the wait list for this program is 3 months. So you're only going to do it in basically June. Given all of that, and the patient's probably like, I'm just going to go back to work because I need to support my family. I need to get all that, So that's one of the many reasons why they don't attend. Yeah.
I guess a good follow-up to that, knowing how that's difficult to reach that 95%, and humans innately are going to choose the path of least resistance overarchingly. How are you going to get into homes to get that other 95% other than just the mobile app? I mean, leveraging the Internet of Things, whereby it's real time. I don't have to think about that time doing that.
Yeah, so your question, I think, has 2 parts, like how do I enroll patients and how do I make sure they complete their programs, right? So for enrollments, the key is really your primary cardiologist and getting their assent, saying, this is a really good program, you have to do it for you, it's good for you. And the second thing is obviously the logistical barriers, which we take away mostly because it's done at home. So getting those cardiologists on board as our champions supporting this is very important. And for that, evidence and showing that it really works is important. Second thing is, even if the cardiologist says that they enroll for these programs, how do you ensure that they're compliant to their programs, right? So that question is really, there's a little objective monitoring that you do through these devices, all the Fitbits and all the latest and greatest gadgets. But really, it's the key thing is the nurse-patient relationship and the accountability that comes from that. The nurse is really the key person who that person has to feel accountable to. And that's why we have high-frequency phone calls in the beginning to really establish that relationship. Before they begin their program, there's like two classes they have to attend in person where they establish the human like they talk to a real human being and really get that relationship going. So that's one of the key things that we do. And besides that, we have other tricks of the trade where we use like triangulation techniques to make sure that they're actually saying the truth. We ask them 3 times, and they say 3 different answers. Probably none of the answers are correct, right? So those kinds of things are included in the multi-fit program. We do all of that stuff as well. Yeah.
Harsh, do you have a direct competition?
Sure, yeah. Direct competition would be, there have been 2 large, similar-sized companies that have worked in cardiac rehab. There's Wellframe that I know of, and then there's Hilarium. Besides that, there's like Vida Health and Vivify. And so those have been like some of the digital health companies or patient engagement platforms that have worked or have some sort of a cardiac rehab program. And I think the real differentiator for us has been this program is considered the gold standard of home-based cardiac rehab. Like in the last ASCVPR conference, which is the governing body for cardiac rehab, this program was mentioned like 4 times by leading all the keynote speakers, and we have exclusive access to that. That's really helped, and the original team as well. So that's really, I think, been one reason why clients have been able to trust us. We've had one client who tried one of the competitive solutions and switched to us as well. So that's been key for us. Yes, please.
Is the time that the patients spend with their coaches, is that time of the coach reimbursable?
In a fee-for-service system, there is one code, which is the 99490, which lets you do that, but most hospitals don't use it. Really, in the fee-for-service system, the driver it actually helps patients come to more sessions because they're more connected with their coaches, and that's why they do it. That's why the nurses do it. In a value-based system, that time is, you can bill under a code. It's not reimbursable, but really the idea is by giving more patients access to the service, you're preventing readmission costs, which is why the nurses do it. So to answer to your question, short answer to your question is no, but there are subtleties in the answer as to why people do it.
How do you incentivize patients to utilize your product?
Well, simple question, like, so we have like so when we go to a patient and we ask them, so we want to get patients enrolled, right? So we have specific questions and a specific marketing sheet that we give them. And so questions like, first thing is the cardiologist and the lead nurse talk to them and ask them, do you want to come back to the hospital? Do you want, you just had a heart attack? How do you feel about changing your lifestyle so that you don't get it again? So really speaking to that emotional aspect and the personal aspects of it, and using that as a driver to basically give them this care. And the key thing here to remember here is that these people are extremely motivated in the beginning because they don't want to go through what they just went through. And that's the key there, which I think we have an advantage as opposed to a preventative strategy where the goal is very amorphous in terms of what they have to do. So that psychology works to our advantage in addition to whatever enrollment and training that we do for patients when they sign up for these programs as well. Yeah. One more in the back.
Are you providing the nurses, or are you enabling the hospital's nurses?
We enable the hospital's nurses. Yeah, so there's basically a 2-day training program where we coach them on how to use the system, teach them how to recruit patients, all of that stuff. Actually, I think we're trying to make it remote so we save on our internal costs as well. But generally, that's how we do it. Yeah. Right. Thank you for the opportunity. Look forward to talking to you afterwards.
That was great. Next, we have Dr. Sean Kant. He is the VP of Healthcare Strategy for Bioscape, and their technology is a tablet-based solution for hospitals to enhance patient engagement and maximize revenue potential. So, Sean, if you'd like to come up.
Good afternoon, everyone. My name is Sean Kant, and I'm the VP of Healthcare Strategy at Bioscape Digital, based in Atlanta, Georgia. Engagement. What a powerful term. Whether you're a physician, a teacher, a parent, or a supervisor, everyone's trying to get other people to care about something. One way is to force them. Another one is a way to tell them. But what I've realized the most powerful is to engage them. Engagement elevates one's desire to accomplish a task or reach a goal, which then becomes empowering. Prior to joining Bioscape, I completed medical school, and during the basic sciences, I was constantly fed information from professors about anatomy, about biochem, about micro. I was involved with my learning, but it was completely a one-way process. It was lecture style. This also was partially true in my clinical rotations. When attending physicians would constantly quiz me about certain topics like path or pharm or micro again, but the time I learned the most was when my attendings engaged me with the patient along with the rest of the team. I naturally wanted to learn more to help myself and everyone else around me, including the patient. Additionally, I became more and more engaged to the various learning styles. For instance, in my second year, my school started recording lectures, which ended up being of tremendous help as I could revisit topics that I didn't understand or wanted to refresh upon. And then in my clinical rotations, I remember reviewing 3D simulation videos about various diseases and procedures, which allowed me to better appreciate certain mechanics much more than someone just telling me something or reading it in a book. Thus, technology played a huge influence in engaging me as a student. And I have no doubt that technology has influenced and engaged each and every one of you. From kiosks at the airport, to shopping online, to advanced clinical procedures. The technology exists to put people, including patients, more in control of their health. But why isn't this happening more? Well, for one, healthcare costs are skyrocketing out of control. Everyone's worried about maximizing reimbursements with fewer and fewer resources. So you're seeing consolidation amongst hospitals, you're seeing hospitals acquire physician groups, you're even seeing physician groups partnering with one another, all in order to manage the bottom line. But what I realized in medical school, especially in my third and fourth year, is that patients are in a hospital because they are sick, because they need help, because they are in pain. And when people feel pain, they're more prone to be engaged to eliminate or prevent that pain from occurring again. Yet most providers are only scratching the surface on addressing that issue. You see, we have this captive audience in front of us, a patient population that is seeking help at the hospital. This is a huge untapped resource. At most facilities, patients interact with the providers and staff to accomplish certain tasks. However, most providers and staff are really busy, either screening patients, seeing patients, meeting with their families, or completing orders. So at Bioscape, we believe that the patient can be utilized, there we go. So at Bioscape, we believe the patient can be utilized more effectively to complete several of the same tasks and have that information disseminated to the rest of the healthcare team. By doing this, patients feel like they're more in control of their health and thus become more and more engaged, which becomes even more empowering in the long term. Engagement revolves around 4 pillars. It must be timely, low friction, customized, and relevant. As a patient, we already discussed the timely nature of this cycle. They're in the hospital because they're at a pain point. Low friction. There needs to be a seamless method to get patients more involved with their health. If they have to do something and wait hours before receiving any notifications or results, they'll become less engaged. Customization. Each patient has to feel like they're unique and important. So a patient in the emergency room, they can't be engaged the same way as a patient in the cardiac observation unit, for instance. And finally, relevance. The content used to engage someone needs to be specific and well-targeted. Otherwise, they'll lose interest and become less engaged. Up until this point, Hospitals have always engaged with the patient. There's no denying that. I mean, they are a funnel piece of the clinical framework. However, we believe that there's room for improvement. Patient satisfaction has been a big buzzword in hospitals over the last few years. But engagement also includes patient health outcomes and operating hospitals at the efficient frontier. Here, resources will be efficiently utilized to improve the entire clinical mix, from hospitals to providers to patients. At Bioscape, we help hospitals operate at the efficient frontier. Bioscape provides a cost-effective, tablet-based solution to enhance patient involvement and thus improve the overall hospital experience, both for the patients in the emergency room as well as those on the inpatient side. Bioscape's bedside technology integrates text, audio, and visual imagery into an intuitive touchscreen experience for patients of all ages and backgrounds. This allows them to become more educated, entertained, and engaged with their health. In turn, hospitals can improve patient satisfaction, they can gather and perform service recovery, and maximize revenue potential all at the point of care. But what does that all really mean? Let's hear what Amy, the emergency department director at one of our hospitals in Jacksonville, Florida, has to say.
Patients are really excited about utilizing the tablet. It's something that's unique to our market. It's unique to our facility. It's a mechanism for them to understand a little bit more about their care through the patient education modules. It's also a platform for us to be able to advertise different service lines that we actually do provide in the facility. It's a mechanism for them to provide feedback to us. It also serves as a whiteboard as the physicians and the nursing staff sign up for the patient in our electronic medical records.
We've been very fortunate thus far, having exponentially experienced our total number of hospitals and channels since launching at our first site in 2014. We crossed the 1,000 tablet mark earlier this year and project that number to grow even more in 2016. Having said that, as fun and exciting as growth can be, it also creates new challenges. Therefore, there must be a strategy in place for effective growth to occur. This involves scaling at the right time, at the right place, and with the right people. At Bioscape, this means hiring the right people to our sales, account management, and development teams. It also means partnering with the right investors, hospitals, and third-party affiliates. Priorities must align amongst all involved parties in order to adequately grow and climb to higher levels, including the patient, who is a fundamental building block to all of this. By having an engaged patient, we can provide better returns for the company, along with better services to the healthcare team. From follow-up appointments to medication reconciliation, the possibilities are truly endless. But communication is key to all of this, and we must never forget that. The technology is there, and at Bioscape, we believe innovation shouldn't wait, as summarized in the following video.
How long is this going to take? I feel like I've been here for hours. Are my test results done? I know they're busy.
We're busy. We had 2 trauma cases this morning, and everything is now in a tailspin. It doesn't mean we don't care about every patient in here. We do. It's our job, and we love doing it. It's just that there's so much going on that patients just don't see behind the scenes.
Hopefully somebody will come and check on me soon.
Communication is extremely important. It alleviates stress, it makes people feel better. But there's got to be a better way.
There's got to be a better way.
Maybe there is.
It's kind of chilly in here. I used a tablet to ask for a blanket. Pretty cool.
shouldn't wait.
Thank you.
Does anyone have any questions for Dr. Kant?
So, what do you do about the cleanliness handing tablets from patient to patient?
Swedish American has been serving the healthcare.
That's a great question. So we manufacture the hardware ourselves, and so we worked with our hardware manufacturers to put a special coating on the tablet and the case that it encompasses to be able to utilize and leverage the existing resources available in the hospital in order to address that issue. So the purple tops, gray tops, whatever it is that they utilize in the hospitals, cavi wipes, we're able to utilize those on our devices as well. So we work with the hospitals and their staff to figure out who is exactly doing that, whether that be the nurses or a specific crew that does that, and we make sure that they're trained in order to include the tablets during that process. Yes?
We're actually a customer in a couple of our hospitals, and I like them. They work well, and when they work really good, gives great immediate feedback to have immediate service recovery. But they don't pick them up enough. Have you guys worked on a way to get the patients a little more engaged to put their phone down and pick up their tablet? Because that's what I've seen a little bit more than I would have liked. But they do work great.
Absolutely. No, I appreciate that. So the key element to all of this is getting the staff more engaged as well. If the patients don't know that the tablets are for them, they're not going to know to utilize it. And so that's the biggest issue, is that the biggest challenge that we face is making sure that the staff educate the patients on the tablet being there. And so we work with the hospitals accordingly to figure out what the best way to do that is, whether that be new processes. You know, we work with the marketing department, especially if there's a specific video, a welcome video from the hospital director or the CEO, whatever it may be. We train the staff to, once the tablets have been utilized with the cavi wiped and cleaned, they're encased in a stand, and we have them prop the tablet on the bed. That way, whoever introduces the tablet or whoever introduces the room to the patient also introduces the tablet with it. That way, you're getting that confirmation there. In addition to that, we are constantly developing new ways to integrate different features on the platform to make it more interactive for the patient and the staff. So, for instance, in addition to the education and the entertainment with the games and whatnot on the platform itself, we implement things like incorporating the TV channel guide on the actual tablet device itself. That way, they get them more interactive. It becomes more of a all solution set than just a couple different features.
I wanted to know the breakage rate, the loss rate, the theft rate, the Craigslist rate. How many of these disappear from the facilities?
Great question, and that's the first question that always comes up when we do any sort of pitch to the hospitals. It's actually very low. We started off with a whole different model where we would supply iPads and give them to the providers who would then give them to their patients. When we were doing that model, we lost a lot in a very short amount of time. So what we did is we developed a solution to where the tablets are basically tethered to the wall. There's an electrical cable and a security cable that run together. One side goes to the actual tablet and security case, and the other goes to the electrical outlet. But in that process, it's hooked and tethered to the wall. And so unless the patient has wire cutters or the staff, the actual bracket is not mounted in the wall correctly, it's very unlikely that the tablets do walk away. And so we have over 1,000 plus devices out there. Probably since we moved to that new model, I would say 5 or 10 units max have walked away. And we're in places like inner city Atlanta, Memphis, places where you might suspect that happening.
You customize your content by facility?
That's correct. So we work with each facility to customize the content and the platform, and also where it is in the department, where it is in the hospital, excuse me. So the layout is in the emergency room is going to be different than the maternity unit, which is very different than the peds unit. Having said that, we work with the marketing staff and the department heads to figure out what exact content they want to include on the platform. So a lot of it is the same in terms of the education, because we have a whole library that they can choose from depending on the different unit. Or if the actual hospital has created content themselves that we want to integrate, or they want to integrate on the platform, we can do that as well. But the specific feedback questions, if there are certain items that the hospital department wants to work on, we can customize those questions. We can customize the layout. We can, if the hospitals want to advertise and market different services throughout the hospital that they want to get in front of the patients, they can do that through the platform as well. That's correct. So we have basically it's a subscription model. The hospitals pay us a monthly fee in order to operate that. There's a few one-time costs built into that, but essentially it's a subscription model.
So why wouldn't you just create a mobile app for each of your facilities that patients could download while they're there, as opposed to having to deal with the hardware issue?
Yeah, no, great question. There's a few things to that. Not every patient has a smartphone, and so that was one issue that we realized, especially in a lot of the hospitals that we're targeting, is that if we provided a hardware software solution to the hospitals, it would be more favorable to them as well as to us. Having said that, right now we currently operate a solution for patients to utilize during their hospital stay. I think as time goes on, we're exploring opportunities to where there could be an app where they would be able to see and explore content beyond the hospital stay at home, whether that be aftercare services, whether it be the content that they viewed at the hospital, they can view at home. There's a lot of things we can do to that. But for now, the hardware software solution seems to be what most hospitals are asking for. Thank you.
So again, you will have an opportunity to talk to all the presenters during our networking reception, which is right after our closing keynote, who is Charlie Brock, CEO of Launch Tennessee, and a well-known individual here, health leader in Tennessee. So Charlie, if you can come up, please.
Thanks, Shivani. Okay, now I'm not a well-known health leader, I promise you. In fact, when Shivani and Russ called me a while back, month and a half ago, said, would you give we're having this Health Connect, and we're going to have a lot of healthcare professionals and investors, and we'd like you to give the closing keynote on healthcare. I said, there are probably about 1,000 people, and that's probably an understatement, who are within a 15-mile radius of where I was at the time, my office a mile up the road, who can give a more relevant talk about healthcare to a healthcare conference. And they said, well, that's actually not what we want you to talk about. We want you to talk about collaboration. And maybe there's some things we ought to be doing, thinking in the healthcare arena in terms of collaborative efforts, and maybe there's some things that y'all are doing at Launch Tennessee that we might glean from that. So that's what I'm here to talk about, and I see several folks that we have collaborated with on other occasions, Sig Mosley. I also see Jim Stefansic out there, who worked with us at Launch Tennessee, and as he knows well, collaboration is one of our core values, and really we believe it inherently and to the bone that collaboration is key to our success. So we're a statewide public-private entity that really is trying to foster entrepreneurship, innovation, and capital formation across Tennessee. We're a 3.5-year-old organization, and without going into all the different things that we do, I want to just talk about a few examples in the 8 minutes I have left to talk about some examples around collaboration that, again, maybe there's some nuggets in there that could be helpful as you go back to your communities and are thinking about collaboration in healthcare. One of the things is we stand here in the Entrepreneur Center in Nashville. One of the key collaborative efforts that we have is we have a statewide network of entrepreneur centers. This is certainly the crown jewel. They're all not 25,000 square feet across the state. They all wish they were, but this is a fantastic place. But we do have others across the state. And we are very much, we help fund these entrepreneur centers financially. They're public-private as well, but we're part of the public funding. And then we're a connector and a collaborator for them. So not only do we get the staff together and the leadership of each entrepreneur centers together on a regular basis to share best practices, to talk about programs that are working, that are not working, to also talk about entrepreneurs and are we making sure that the entrepreneur is in the very best place for success for his or her business. So that's one way that we collaborate and try to, again, push entrepreneurs around the state if they're doing a project, health accelerator here in Nashville, or the ones they're running right now around Project Music or 1440 around publishing. Let's make sure if we've got an entrepreneur in Chattanooga or in Memphis or wherever who's doing a cool thing in music tech or around publishing, that they're here in Nashville going through this program. Doesn't mean that they can't go back to wherever their hometown is, but they ought to be getting the best kind of mentorship they can get for their 14-week program. So that's one way we collaborate, and it's been very effective, and we continue to work on that and try to enhance that collaboration. Another way, second way, is what we're now calling innovation and commercialization networks. And so, as you well know, being in healthcare, a lot of companies, particularly in life sciences, don't neatly fit into a 14-week accelerator program. It's a longer-term process to go through, FDA approval. It's just a lot of different things involved with life sciences. And there's also a lot more domain expertise that we need as from the mentors. And they may not or may not be available within each of the Entrepreneur Center municipalities, if you will. So the network is really, again, a statewide approach. We hired in collaboration was in conjunction with Life Science Tennessee, and Jim really led this initiative when he was head of commercialization at Launch Tennessee. We worked with the statewide association. We've selected and are helping trained and pay for a person to lead this effort, to lead the mentor network, and we now have over 50 mentors across the state who are working with life science companies. And what's really cool, and it's a 6-month program for the companies, and what's really cool is about 40 of those folks, those mentors, were not involved previously in the ecosystem in the Entrepreneur Center. So it's really pulled some more people off the sidelines, getting them engaged. And we're actually in the process right now of setting up innovation and commercialization networks, same kind of thing, for agriculture, for energy, and for automotive. And then over the next 6 months, we'll have all those others set up. And then we really see a network of networks. And how do we collaborate across those different industries, provide best practices around mentoring, to provide connections to potential investors and others. And then how do you think about the network of innovation commercialization networks and the network of entrepreneur centers, and how do we start to collaborate? So we've got some really exciting things on the drawing board over the next 6 to 24 months to really further that. Another way that we've collaborated and had some success is something called reverse pitch. And as the name implies, it really flips the roles of the presenter and the audience. Many of you have probably, if you're investors, you've been to demo days. I know Sig Mosley's probably been to more demo days than he cares to recount. But it's the entrepreneur, not that you're old, Sig, but you've just been around doing a lot of demo days. And he was doing angel investing before the rest of us, we were just thinking about doing an angel investing. He's led the way for many of the rest of us, which we appreciate. But these demo days are with entrepreneur pitches at the culmination of a 14-week program in the room full of investors and industry and community supporters and whatnot. So we flipped it. So we invited existing industry to pitch real problems within their corporation or blue sky ideas to a room full of folks who could presumably solve the problem, whether it was developers, designers, entrepreneurs, innovators, researchers, whatever it may be. And then we opened up a portal the next morning on our website and had 45 days to respond to that. So it's a great way for corporate to source innovation and it's a great way for the folks in the audience to get business development opportunities with companies that they would otherwise have a hard time getting in touch with, or getting in the door with. And we had folks like Blackstone out of New York came down to pitch, and we had FedEx, and we had Smith & Nephew, which is a large medical device company, many of you know, in Memphis. We had the folks from Bonnaroo. We had the city of Chattanooga. It was a great mix, and we're actually doing those around the state. In fact, we did one, talking about collaboration, we had one just last weekend in Jackson, Tennessee, that the audience was actually college students from around the region. And then they had 24 hours to come back and pitch their ideas to help solve the problems. So we're always looking, as we look at the stakeholders across the state, from entrepreneurs to investors to researchers to college students to existing industry to community supporters, and we spend a lot of time on the whiteboard at Launch Tennessee saying, how do we connect some of these groups? And if we do, what are the hopeful outcomes, and what's the short and long-term plan to help affect those in a positive way? Finally, and then I'll stop, the last effort at collaboration that's been a real big lift for us, and again, SIG knows this well, and some of the others in the audience may have been to our conference, y'all 3686. And it's here in Nashville, and those are actually the coordinates of latitude, longitude of Nashville. So it's certainly a Tennessee event, but we invite top startups from around the Southeast to apply and be part of that, because really our belief is that we all suffer from a dearth of capital in the Southeast. And the more that we can connect, get to know each other, get to know each other's companies, and get capital flowing across state lines, ideas flowing across state lines, that's a great thing for all of us in the region. And also, very important that we solidify, and come together to shine a light on some of our top startups and do that to investors on the coast, coming from California, coming from New York, coming from Boston. So, and yes, we're Launch Tennessee. We wake up every day thinking about Tennessee entrepreneurs, but we also, in this case, believe that it's so important as a region we do that. And so the pitch to the investors in California say, you're going to get a great look, not only at some good Tennessee companies, but also some great companies from Atlanta or Greenville or Tampa, Florida, or wherever the case may be. So last year we took in applications from 12 different southeastern states, 36 companies, 7 states were selected. Those 36 companies came from 7 states plus DC. The winner was actually from Atlanta. And as further collaboration, we took the winner out to the coast, out to California with us a month ago, as we were taking other Tennessee companies to say, here's an example of the kind of talent that you see at this conference. So it really is a way to collaborate. And I know this is a conference a lot about collaboration. So really encourage what you're doing. If there's anything we can do that would help, again, I'm happy to show you, give you more detail on any of these things that we're doing. It's interesting, I'm leaving tomorrow morning for Birmingham, and then I'll be in Atlanta next week, and then in North Carolina the following week. As part of our 3686 program, we actually do regional pitch events around the Southeast in April, and we'll qualify some of the companies. So we really are putting our money where our mouth is to say we believe in this. We'll come into your communities, work with local judges, help select top startups, and really shine a light on those areas. So that's what we're trying to do to enhance collaboration really across the Southeast and certainly within Tennessee. So I don't know if there's time for questions, or I'll be happy taking questions if there are any. I'm standing between you and a beer, I imagine. So I'll turn it back to you, Russ.
Great. Charlie, thank you so much. I appreciate it.
Yeah.
Great. I'll be brief, but I do want to thank all of you. I know everybody is crazy busy, starting companies, incubating companies, launching companies, running companies, and to take time out of your calendars, your very busy calendars, to be here. On behalf of our staff, our board of advisors, thank you. However, as I mentioned, we're not here for leisure. We're here to learn, and we're here to help. And so we want each of you to take that charge very seriously. I hope you take time today to help someone. It's just that simple. I'm reading a great book called The One Thing. And if there's one thing that I hope each of you leave here with, it's your own personal ability to help someone else. There's a lot of need, but there's a tremendous amount of ability, both in this room and in this region, and that's what we want to help to unlock. So with that, we've got a great reception. Please take time to meet at least one other person you haven't met. There are some phenomenal people in this room, and so thank you all. Look forward to seeing you in Atlanta on September the 21st for our very large regional gathering, and everyone is invited. Please watch your emails closely. We've been very fortunate in the past to have some of the biggest names in health and healthcare. We look forward to continuing to do that with your help now throughout the region. To our panelists, thank you. It was awesome. I learned a lot. To our presenters, thank you. Those were awesome ideas, and very glad to see them take flight. And with that, we are closed. Thanks, guys.